Welcome to Follow the Medical Record, where healthcare experts give insights into the increasing importance of following a patient's medical record through the health ecosystem with compliance, privacy, security, and efficiency front and center. This podcast is brought to you by MRO and hosted by Don Hardwick, Senior Vice President of Client Relations at MRO. Don has been in the health information management industry for over 40 years and has extensive knowledge of how medical records make their way through the healthcare ecosystem. At MRO, Don is responsible for strategic client engagement programs and overall client satisfaction. To hear from all of MRO's industry experts, be sure to visit mrocorp.com for additional content and to sign up for our monthly e-newsletter. Over to you, Don.
Hi, everyone, and thanks for tuning in to Follow the Medical Record. I'm your host, Don Hardwick. You can learn a little bit more about me and my background on MRO's website at MRO Corp and can connect with me on LinkedIn. Also, be sure to follow us on Twitter at MROCORP. I'm excited to have Cassi Birnbaum with us today. Let me give you a small snippet of Cassi's background. She is currently the Senior Enterprise Director at PeaceHealth, where she oversees its Health Information Management Department, coding, and CDI activities. PeaceHealth is an integrated faith-based organization in the Pacific Northwest with hospitals and physician practices in Oregon, Washington State, and Alaska. Cassi spent many years with other large healthcare organizations where she provided enterprise-wide leadership over the Health Information Management Department, revenue integrity, coding, clinical documentation, and has served as the Chief Privacy Officer. Cassi also currently serves as a board member and incoming board chair of CAHIM and is an officer of San Diego Health Connect, which is a regional health information exchange, and served as board chair and president of the American Health Information Management Association. Cassi, I would go on and on about your resume because you look like a who's who in the field of health information management. But in short, Cassi, thank you very much for joining the show today.
Oh, thank you, Don, so much. I'm happy to join you as well today.
So, Cassi, we're going to be discussing why it's important to have an enterprise-wide approach to any outsourcing and specifically ROI in an organization your size. But before we start, can you tell our listeners a little bit about the medical record itself? What goes into the record and who has the right to obtain that record?
Great question, Don. So it really begins by defining your designated record set as set forth by HIPAA. And many of us in the HIM arena have called this the legal health record. But really that terminology was really superseded by the designated record set. And this is something that we really need to lean into as we transcend to the next phase of information blocking, the 21st Century Cures Act. But privacy requires that HIPAA-covered entities, which is health plans and most healthcare providers, provide individuals upon request with access to protected health information about them in one or more designated record sets, again, maintained by us as a covered entity. And really, in terms of who has access to patient records, certainly patients have the legal right to copies of their own records. A loved one or caregiver has the right to get copies of your medical record if you've given them permission. And healthcare providers have the right to see and share your records with anyone that you have given permission. And then, certainly with other covered entities, there are rules that apply as well. And just in terms of kind of who owns the legal record, really over time, we really want to see that the patient owns the information, but as medical professionals and doctors in particular, and health systems like us, we own the actual infrastructure that maintains the record. So we're the custodian of the records. We care and feed the record, but really the patient owns the information with rare exceptions. So we really need to make sure that we, safeguard the record and really assure that it's maintained, in the best interest of the patient.
See, with some of the legislation that's been occurring in the recent past, giving patients more rights and access and availability, in your history, you've held many positions with hospitals. Have you ever seen that was an issue to begin with, that patients felt like they didn't have the right to access their medical records, provided they went through the proper channels of completing an authorization to obtain that information? Did you ever find that patients weren't able to get the information that they wanted?
Yeah, if you look at the OCR and complaints that have been leveled against, providers and other such entities, you do see that, definitely, especially in the early days of HIPAA, that there was a misunderstanding, and some providers did put in unnecessary barriers to access. Certainly we do everything along with our partner MRO to assure that nothing is blocked. And, we try to give the patient a number of different avenues to obtain their record. But, there certainly have been perception that perhaps we were blocking that information, especially if they went through a third party to request that information. So it's really important that we, have a good process to timely communicate with the patient to make sure that we fully understand their request and that we fulfill it in not only a timely manner, but a complete manner.
That brings up the complete manner, a manner in which they can obtain that information. As a network, an overall enterprise, why do you feel that it's important to have a single vendor processing these requests for patients and other requesting parties as well?
Certainly. Well, as you can well imagine, for those of us that are in the trenches and have seen the evolution of release of information, it's very complex. Despite the fact that we do have electronic health record systems that, may have an application that is designed to handle release of information, it really doesn't mean to say that, there isn't a need for specialized resources. Layered on top of HIPAA are all the state laws that, and we have 3 different states. And probably our most challenging state is Washington. And so their requirements are, more stringent in many cases than Oregon laws, for example. But there are nuances in Oregon laws that maybe Washington doesn't have. And so it's really important that we have a partner who can really help to not only provide us with the resources that we need, but also has some technology solutions that really layer on top of perhaps some of the electronic health record features that we have. The other item too, that just to go back to the information blocking and 21st Century Cures Act, is that we don't want to be a barrier to the patient and their request for information. So from a vendor-partner relationship, it's really important to address any gaps that we have and to have a seamless process that, again, reduces, anything that could get in the way of a patient requesting information. And some of our patients aren't as sophisticated and, don't want to access our portal, and may want to call and ask for information, and may want to mail an authorization. So we need to meet the patient wherever they are in that process.
So, Cassi, you bring up a good point here, is that there are various areas. It's not just the medical record itself, but there are other departments that contain information that patients and other requesting parties need for the information that's contained in a hospital in general. So when you were looking at this whole process of an enterprise-wide release of information management approach, were there other departments that were considered or had input during that evaluation process?
Absolutely. We involved our network leadership in that process. So we definitely wanted to have, along with compliance as well, they needed to be sitting at the table helping us make the decision. So we did include from each of our networks, IT, our clinics, our medical group leadership, because they too have release of information needs. IT in terms of bringing to bear some of the integration opportunities that the vendor would be able to help us with this process. And we really wanted to make sure that we all had a good understanding of the current state and challenges, and really what the best pathway forward for the future state, and as well as having that potential partner define the transition path and level of effort involved as well. And again, we wanted to look at an enterprise approach that enveloped all of our networks, all of our medical group, all of our practices, as well as future state with Community Connect and those organizations that perhaps aren't aren't owned by PeaceHealth, but are on our instance of Epic and have agreed to our terms of have a contractual relationship in that avenue.
How was that process? Was that painful during that time to get all of those different departments and entities together, or was there a rising tide of demand, I'll just put it that way,
okay,
of similar problems and experience that was going on?
Absolutely. So what really led to kind of looking at what was available in terms of a partnership opportunity, at PeaceHealth, we already were a full outsource, but there was a high degree of discontent with the level of quality, customer service. We were experiencing a high level of patient complaints. The vendor at the time had trouble with staffing the function. The turnaround times were unacceptable. The approaches from a technology standpoint were suboptimal. And we really wanted to develop a partnership and a relationship to enable us to proactively, set ourselves up for success and not, have to chase after issues and, do customer recovery versus, meeting customer or exceeding customer expectations at the get-go.
There are a number of companies out there that perform release of information. Did you use any outside sources to help evaluate your selection process? There's a company called Class that most healthcare professionals are familiar with, and Class evaluates the vendor community and then ranks those vendors based on input from facilities that they service. So did y'all use CLASS as one of your evaluation tools by chance?
Yes, I'm very, I've worked with CLASS over the years as an evaluator of vendor solutions, as well as consulting and services types of solutions. So I'm very familiar, have a good relationship with the folks at CLASS. And so this definitely was one of the items that was looked at as far as looking for best-in-class solutions, and then looking at, the feedback and, as well. So this definitely was one of the things we looked at, as well as talking to current clients of the vendor as well, just to make sure that they were satisfied with customer service, compliance.
So, Cassi, during your implementation, after you've made your selection and then the implementation process begins, how would you position the implementation process in terms of your experience with other implementations? Was this one a smooth implementation? Did it have its stumbling blocks? So what was the experience after selection?
Well, there wasn't a long runway in terms of implementing with MRO. There was a lot of dissatisfaction with the current state. And so there was a lot of pressure to, implement quickly. So we did need to do a big bang implementation. We did have a rigorous planning process and an opportunity to really look at our policies, procedures, state requirements as well, and really harmonize that with MRO. MRO was able to look at the staffing from the previous company and identify individuals that met the requirements. Not all, but some. So that really helped to fill some of the positions, as well as they hired additional staffing, and then there were some functions that could be backfilled through the National Service Center. But there was a continuous communication and almost daily meetings that occurred in order to be able to really bring this up quickly. One of the pieces we didn't have at the get-go was the E-Link, which is the integration between Epic, which is our EMR, and MRO. So that unfortunately took a little bit of a backseat because of the pandemic. We implemented prior to the pandemic in January of 2020. But I was able to get that to the front of the line, once we were able to kind of re-engage our project portfolio. So we were able to get that up and running, I believe, in November of that year. So that was good. It took a little bit longer than I would have liked, but we had several other projects that were, in the starting gate. And then there were a couple of other things that we needed to do also, just to get ready for the 21st Century Cures Act and information blocking, where we used MRO's expertise to really help us with our document templates to help with release of information.
Cassi, speaking of document templates and your policies and reevaluating how you were doing things and how you were going to do things with MRO, what best practices did you learn out of that, or were there any that any things that occurred? You were saying a minute ago that you held weekly meetings so that you kept everything on track. Was that a standard practice within your organization, or did you do this because of the short runway, as you mentioned, in terms of a time frame for getting all your locations up and running? So were there any best practices or things that you learned that you could apply with other implementations for other vendors?
Well, we continue to have weekly meetings, but you know, at the beginning of the design phase, we were meeting, you know, more frequently than that. And I think that both of our teams have evolved over time. You know, certainly the pandemic, you know, provided some challenges because we had on-site staff, and then the MRO staff is working remotely but dedicated to PeaceHealth. And we've been able to put in eXpress, you know, to help with other types of requests. One of the things that wasn't fully built out, and after my arrival, I saw that we didn't have a good workflow in our patient portal, because MRO also fulfills those requests, and that's a very short turnaround time. So that was an area that we really needed to develop, and we needed the MRO staff to really lean into the design, the workflow. MRO was very involved in, you know, helping to bring. I knew of another client where I had worked before, that a client site that had a good workflow process, so we were able to meet with that client, a client of MRO, and really emulate that process, so that from a fulfillment within the MyChart application, we were able to design that in an optimal way. Document templates was another area that they had some legacy templates, but we really knew that that would streamline the fulfillment process, standardize it, and really increase the efficiency of the MRO team, and you know, give us the assurance that they had everything they needed. So that was, again, we had MRO reach out to a client that had recently gone through that process, and so they were able to kind of give us some demos of how that worked in their system environment. And so that was another area too that we partnered and created some really value-added solutions along the way. So again, we continue to learn and grow. We identified too that the policy or procedural document that was developed prior to go live had kind of out-of-date artifact in it. So we recently just, you know, went through that process as well. And then also just developing, for example, some escalation processes. So if there is a question, or, you know, if a patient keeps requesting, or an authorized requester on their behalf keeps requesting the same thing over and over, let's dig into it and find out, you know, what's behind that. So really, you know, wanting to make sure that, you know, our team is apprised where there are, you know, hiccups or a dissatisfied requester, you know, whether it's the patient or another party. So just really, again, fine-tuning the process and, you know, having that evolve over time. And especially as MRO provides to us some new technology options. So, for example, with the MRO eXpress, that was an area where patients that, you know, for whatever reason don't want to use our PeaceHealth, which is our patient portal, but want to use a web link to obtain records, or other requesters want to utilize that platform, that really streamlines things for the requester. and integrates into ROI online. And so that's something that has helped us.
I think as time goes on, there's just going to be a bigger and bigger push for patients to have that access, like you're saying, via an electronic methodology. And that way they can obtain the information that they need virtually 24/7 so that they can either, satisfy the need that information brings to the table, whether it's a legal issue because of an accident or whether it's a continuation of care piece that they need from that record. They'll be able to obtain that information at their will and at their leisure and convenience. I think there's, just because of one of the things you said, COVID ushered in a totally different approach to obtaining all kinds of things, whether it's shopping or whether today it's medical information, that doing it without having to travel or go into a facility and perhaps be exposed to, and in this case, for that 2-year period, to COVID. So they were still able to obtain the information in a convenient way, and I think that's going to drive forward as we move forward into an electronic age.
But, yeah, I think that MRO eXpress really provided the ability so that you didn't have to have fulfillment centers at every acute care hospital. So as long as we provide, how to access medical records, again, providing, different options, some will, resort to kind of the paper process, printing an authorization and filling it out. But for the most part, this has really been successful for us. So again, it's really helped us to lean into where we might have gaps in the process so that we can, partner with MRO on improving those. And one of the areas too I wanted to mention is just the payer relations area. We have a lot of payers that, are doing through their Medicare Advantage populations. They want to do kind of a sweep of records, thousands of records. Some of our Medicare Advantage payers, look at 8,000 to 10,000 records a year just to see if there's some recoding opportunities with risk adjustment, and also with their HEDIS information. So it's really nice. The MRO has a division that really focuses on that, as well as some opportunities from a technology standpoint to address that. So, but that's a big area. And a lot of our payers, they continue to want open access to Epic, and that just isn't something that we're willing to provide to them.
I think that you're absolutely correct. I think that open access opens up some other challenges that is going to be imposed on the healthcare providers out there that I don't think is going to work to their advantage overall, but remains to be seen on that front. But I think just the sheer volume of request for a facility ushers in, another age of complexity on top of what the legal requirements, HIPAA requirements have been in the past. Given those complexities and volumes that you're seeing today, kind of my last question here, Cassi, is where do you see release of information going for the future?
Great question. I really think that, as technology evolves, I really see that perhaps artificial intelligence and kind of using bots might help from a MRO perspective, to kind of reduce the resource burden. All of us are really feeling the effect that post-pandemic, where some of our positions remain open longer than we would like. So if we can use artificial intelligence, for some of those repetitive processes, then that can, perhaps drive down costs or level things off a bit, for providers in the equation. We do have a revenue share model. So in terms of requests for continuity of care where we can't charge for, that's an area that we're really digging into to find out if we can get providers to use the provider portal that's afforded through our EMR. And there are some other options that are presenting themselves if the provider's on another instance of Epic through Care Everywhere. That might be a better way for them to review that information. So I think, we have a responsibility in our partnership with MRO to look at, efficiencies and, how we can scale and scope this so that, we can identify efficiencies, which will reduce turnaround times, improve the requester satisfaction. I think those are the biggest things. Yeah.
I think the bottom line is you hit the nail on the head, so to speak, is that the objective is to improve the client, or in your case, the client meaning the patient or requesting parties, to improve that satisfaction level. And it seems like that urgency is one of those factors, which you described as turnaround times, is one of those key factors, as well as being able to access anywhere the information so that they can get it at their leisure. I think all of these things and driving some of that cost, the labor cost, out of the equation helps all parties. So I thank you, Cassi, for being on the show today. It's very insightful. You have a vast amount of experience, and it's just been a pleasure to have you join our show. So thank you very much.
Thank you.
So for more insights on a patient's medical record through the health ecosystem, visit the show's homepage at mrocorp.com, where you can also explore additional resources through thought leadership. You can also check out the program's page on healthcarenowradio.com. Finally, be sure to connect with us on Twitter at MRO Corp. Until we talk again, I'm your host, Don Hardwick.